Strep throat and tonsillitis are two distinct conditions often confused due to their similar symptoms, both affecting the throat and causing significant discomfort. Strep throat is a bacterial infection caused by Streptococcus pyogenes, presenting symptoms like a sudden, severe sore throat, pain when swallowing, and sometimes fever and swollen lymph nodes. Tonsillitis, on the other hand, can be caused by viruses or bacteria and is characterized by inflammation and swelling of the tonsils, often accompanied by a sore throat, difficulty swallowing, and also possibly fever. Treatment for strep throat typically includes antibiotics to combat the bacterial infection, while tonsillitis treatment varies depending on whether it's viral or bacterial, ranging from home remedies to antibiotics or, in recurrent cases, surgical removal of the tonsils. Risk factors for both diseases include younger age, exposure to someone with the infection, and a compromised immune system. Here's a closer look at the detailed aspects of strep throat versus tonsillitis, including their causes, symptoms, treatment options, and preventative measures. Causative pathogens: bacterial, Streptococcus, versus viral or bacterial. Strep throat, caused exclusively by group A Streptococcus bacteria, is a highly contagious infection that targets the throat and tonsils. Symptoms often include a severe sore throat, pain during swallowing, and fever. It requires antibiotic treatment to prevent complications. On the other hand, tonsillitis can be instigated by various viruses and bacteria, including Streptococcus. Its symptoms are similar but may also present with swollen tonsils, often with white or yellow patches, and sometimes enlarged lymph nodes. While bacterial tonsillitis also requires antibiotics, viral tonsillitis does not. Instead, it's managed with supportive care, as it usually resolves on its own. Distinguishing between them is crucial for appropriate treatment and can be achieved through a rapid strep test or throat culture. Nature of infection: acute rheumatic fever risks versus generally self-limiting. While both strep throat and tonsillitis cause sore throats, they stem from different types of infections. Strep is bacterial, specifically group A Streptococcus, and tonsillitis can be viral or bacterial. A critical concern with untreated or improperly treated strep throat is the risk of developing acute rheumatic fever, ARF, a serious inflammatory disease that can damage heart valves and joints. On the other hand, most tonsillitis cases, especially those caused by viruses, are self-limiting and resolve without severe complications. Thus, distinguishing between these two conditions is crucial, as strep throat requires prompt antibiotic treatment to prevent RF, while viral tonsillitis may only require supportive care. Typical age group: often school-aged children versus all ages, especially young children. Strep throat is predominantly found in school-aged children, often between the ages of 5 and 15, where it hits its peak due to close contact environments and frequent germ exchange. In contrast, tonsillitis can affect individuals at any age, but is particularly prevalent among younger children. This difference is key in the diagnostic process as it guides clinicians when assessing symptoms common to both conditions, such as sore throat and difficulty swallowing. Although both diseases can present similarly, this age-related propensity provides valuable insight that aids in distinguishing between streptococcal infections and general inflammation of the tonsils, potentially altering treatment approaches and management. Treatment approach: antibiotic necessity versus antibiotics or supportive care. Strep throat, a condition caused by the bacterium Streptococcus pyogenes, necessitates antibiotic treatment to prevent complications and hasten recovery. The use of antibiotics is crucial not only for symptom relief, but also for curtailing the contagious period and minimizing the risk of rheumatic fever or other serious sequelae. Tonsillitis, on the other hand, can be viral or bacterial. While bacterial tonsillitis may be treated with antibiotics similarly to strep throat, viral tonsillitis does not benefit from antibiotic therapy and is managed with supportive care, such as pain management and hydration. Therefore, differentiating between the two is essential to avoid unnecessary antibiotic use, which can contribute to antibiotic resistance and carry potential side effects. Clinical presentation: Centor criteria alignment versus broader symptomatology. The Centor criteria is instrumental in distinguishing strep throat caused by Streptococcus pyogenes from viral tonsillitis. It considers factors such as tonsillar exudates, tender anterior cervical lymphadenopathy, absence of cough, and fever. A high center score leans towards a bacterial etiology necessitating antibiotics. Conversely, tonsillitis presents with a wider symptomatology that may include cough, hoarseness, or conjunctivitis, suggesting a viral cause. Accurate diagnosis is crucial as it directs appropriate treatment, circumvents unnecessary antibiotic use, and mitigates complications such as rheumatic fever, which is associated with untreated streptococcal infections.